squeeze a boob, okay? Just squeeze a boob. You're in the month of October. So you just go to any boy and put your boob on the plate and tell the boy to squeeze the boobs, okay? At the end of the day, if he squeezes your boobs and you get horny and you guys have unprotected sex and you have STI or you get unwanted pregnancy, then you come and tell me that you went to the boy for him to squeeze your boob because we were creating awareness that we should squeeze boobs, okay? In fact, the reason why we say squeeze a boob is to catch your attention, okay? Not because we want you to do that. Now, squeeze a boob, you don't have a boob. The meaning is that squeeze your own boob, okay? You have boobs. And you see, males too have breast issues. And trust me, males too get breast cancer. You can get breast cancer as a male, okay? It's not only females, okay? So squeeze a boob, squeeze your own boob, examine your breast, examine your breast and know what's wrong, okay? So first of all, let me use this opportunity to talk about breast cancer, okay? Now, breast cancer is very deadly. That's the reason why we've dedicated a whole month for breast cancer. In fact, if you get breast cancer and you don't detect it early, it can kill you easily. Okay, so we are trying to create awareness so that you can detect it early. Now, let me tell you, there is no particular thing that will cause breast cancer. The things that increase your chances of getting breast cancer is known as risks. Okay, so you have risks of getting breast cancer. The first thing is family history. If anyone in your family has breast cancer, be it your mother, your sister, your siblings, anyone, you're at risk of getting breast cancer. Okay, that's why you constantly have to check your breast, go for screening, go for checkups and stuff to detect breast cancer early. Okay. Second thing is if you take a lot of contraceptives, any small thing contraceptive, unless you don't go and do then you go and drink the contraceptive, unless you see it increases your risk of getting breast cancer. Third thing is if you do hormone replacement therapy, some people after menopause they don't want to experience the problems of menopause, so they can take in some hormones to actually, especially estrogen, to actually be better. Okay, it can predispose you to breast cancer. Aside that, if you never give birth as a lady, you've never given birth, and after 30 years, 40 years, you're still not giving birth, you're at risk. And also, if you give birth, maybe if your first pregnancy is after 30 years, it's also a risk for breast cancer. But all these, you may have all these things and still not get breast cancer. That's why I'm saying that they are risks. It doesn't mean that when you have them, you get breast cancer. Okay. Now, examine yourself. Okay. Usually, as a lady or as a male, once in a while, you have to stand in front of the mirror and examine yourself. The examination is so simple that it starts with what you see. We call it inspection. You stand in front of the mirror, compare the two breasts. Ideally, they should be equal in sizes, but sometimes there is some small changes where one is a little bit larger than the other. It's not so significant, it's not so obvious. But then if you find out that one breast is like this, the other one is like this, she tell you something. Okay. Aside that, you have to look at the nipples, the skin around the breast to find out whether there is any changes. Okay, if you find out that it's looking like an orange, I mean you call it orange peel or pure orange, it's telling you something. If you find out that your nipple is discharging some greenish or yellowish fluid or some blood, it's telling you something. Okay, now after you've inspected it, now you have to touch your breast. Okay, you touch your breast accordingly in a circular manner from one side. So you touch in a circular manner, then you are very, very intentional about it, looking out for any lumps, anything. Okay, looking out for anything. If you find a lump inside, that's where your examination ends. Come to the hospital, we take it from there, we do the necessary investigation, and we treat you. If you detect breast cancer early, in fact, it's curable. We can cure you. You don't have to have any issue. The modalities of treatment include: one, we can do a surgery for you to take out the lump. The second thing, we can do chemotherapy to clear out any cancer cell that has spread. We can also do radiotherapy for you. We can do immunotherapy or targeted therapy. The main thing is detect the breast cancer early. Continue advising people, continue examining yourself, continue going for screening, continue advising on people, because if you detect it early, then you are safe. Thank you for watching this video. Share this video to your people, share this video to any lady you know so that they learn and they protect themselves. Catch you.